Hello guys. Maybe we start with one thing. As today we are in this NFT conference and we are talking about health, then let's keep it also practical. So your job, audience, is to count how many times any of us will say NFT. And the number of times we say NFT, we have to do push-ups. So we try to give the presentation this way that who feels how strong they are, so this depends. But you have to count. So maybe we start with introductions. Maybe Bill?
Yeah, sure. So Ben Neenan. I live in Pittsburgh, Pennsylvania. Started off my career as an epidemiologist. Spent a good amount of time with UPMC, and eventually saw an opportunity to kind of like go over into industry, right? So is there an opportunity to look at global or micro health strategies, put health resources in front of them, and then ultimately use that information to drive decisions on what to make, where to make it, why, how, all that other fun stuff. So started moving into robotics and AI, ML, all the other fun buzzwords. And now I primarily work with startup organizations, different startup tech companies, trying to get them to find like where their beachhead would be. You know, if it's an organization that has a great tool but doesn't have an application just yet, figuring out where we can move that. So that's my background.
Hi everyone, I'm Meta Bananas, and I'm from Singapore, and I've been working for the public healthcare system in Singapore as a speech pathologist for the last 10 years. But now I'm here in Boston. I'm doing my grad degree in global health, and I'm starting to move into the global health space. NFTs has been like kind of a passion and a hobby for the longest time, but now I'm trying to kind of find ways to kind of meld my interest in Web3 with my professional interest in global health and see how we can get those two areas to converge. Yeah.
Hello, I'm Erki. I'm from Estonia. So I've been in crypto since 2009, so the time where the value of the Bitcoin was absolutely zero. So after this, I've built up a couple of companies, as you see from my gray hair already. Currently, I'm mostly working in building a new social network based on completely web-free standards. So the idea is to build a social network of users, for the users, by the users. It's called PopSpot. But maybe we can start, and Ben, maybe you can explain what we understand about the global health situation.
Sure. So when you look at the evolution of healthcare in general, right? Like we can kind of make some sort of parallel with Web 1, Web 2, Web 3, right? Initially it was, okay, how do we just keep you from not dying? Like, can we do that? Can we amputate an arm? Bloodletting was a big thing. All those kind of fun things. Then science took its next little evolution and went into the Web 2 version, right? That Web 2 version being, okay, are there vaccines, right? Antibiotics, other things along those lines. More global applications or fits for the populations of the masses. We're starting to kind of eke into this Web 3 portion of healthcare, which is personalized care. So before you'd go and it's just like this pathway and algorithm, right? Like, oh, unexplained dyspnea, you do this, 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 this. Well, what if you had some sort of like layer that was over top of it, personalized to your own being, right? Your own healthcare, your own background. And now you have your own pathway that just makes sense because it's what you need as an individual, not what some, gold standard is. So there's a lot of parallels between the different evolutions that we see here with like Web 3. And I think that's for good reason as well, right? If you look at the different just the global amount of waste. I don't have the numbers on the top of my head. They were pretty significant, right?
Based on World Bank, I think it was like 30% of the medical healthcare resources were wasted right now. And it's like about 3% of the global GDP. And it's all about the data, and we don't know what to do, and we don't collect or use it correctly. So I think it's like a huge opportunity to just save money and be better with our people.
For sure, I'm hearing a lot about how there's a lot of money going around, but it's not really going to the right places. And I think when we talk about healthcare 2 to healthcare 3, what we're seeing is that a lot of countries are moving into healthcare 3 and doing precision medicine, doing preventative health, moving actually away from healthcare into taking care of people's health in general. But what we're seeing is that a lot of countries, low and middle income countries, as well as a lot of marginalized communities within even high income countries, or refugees, for example, are not really achieving that same move towards healthcare 3 that we're seeing. And that really made me think about, how, as a global health practitioner, how am I going to bring healthcare access and equity of access to the marginalized people. And I think one other way that we can see how this comes together with Web 3 and then as well as healthcare is this idea of equity. So we do want like everyone to be able to access healthcare, and actually if you think about how it is in Web3, we do want everybody to have equal opportunity when they come into the space. Like I don't even show my name here, and I came in as a Chinese girl, and I started a digital collectible project and managed to kind of sell off some of these things and kind of made like a collection and a name in the space. So this equity and equality of access and opportunity is something that I think is really important, and that ethos is very similar, whether it is in global health or in Web3. And the other thing I think is also this idea of decentralizing, because when we talk about the waste of resources, we do have all these big funders like the Gates Foundation, we have Wellcome Trust, we have all these big funders, and they actually decide what the agenda is for who gets what money and which programs get funded, and what, like whether it's malaria or hygiene that gets funded in terms of improving global health. And really we're trying to move towards like a more decentralized idea here, and decentralized decision making. And really I think things like a DAO, things like quadratic funding, these are things that can really help.
Yeah, I think maybe there's countries that have not developed so well have a better opportunity. Because I'm coming from a country that has zero development in 30 years ago when we got freedom from Russia. So it was like blank page. And we can start everything from scratch. No legacy, nothing to start thinking about. And we started the like normal way. Every hospital had their own some kind of database, some kind of information system. But we had one really, really good thing that accidentally happened. Every person has a unique identification code. When we get born, we get this code. And it's very similar to Ethereum address. And all the system across the like governmental system, private company system run based on this identification code. So this means that when I log into governmental healthcare system, it's basically like OpenSea. I see all my assets from all my information from different healthcare solutions. And it works brilliantly. So it's maybe, because when we have seen, of course, everybody likes to make fun of their neighbors. So I take opportunity to make fun of Finnish guys, I hope. They developed a medical healthcare system for last 15 years, spent about 50% of the GDP, and it didn't work. So to solve this question, they made a song out of this. So this is like a PR project, how to fix this thing. But I think this shows very well that when we go to the direction that big governments want to start this, it's going to fail because it just takes so long time and just technology goes faster.
Yeah, I think the United States has done a really good job of showing what not to do in a lot of those cases. For those of you familiar with electronic medical records, the first one was here in the United States in 1972. It wasn't until 2000, if anyone's read To Err is Human, basically just highlighted all of the issues that we still have in healthcare, even though we have universal languages and all the other fun things to do this and do that. And then not until 2009 was there some sort of actual government or federal level push here in the US to actually transition United States healthcare over to this electronic medical record system. With that said, anybody have a guess on how long it would take for a hospital to upgrade or to convert from like Cerner to Epic? Just on average, small hospital to 300 bed facility, it's about 8 or 9 years. 8 or 9 years. So by the time they implement it, there are already like 3 or 4 versions beyond it, right? And that's one hospital, right? Imagine doing a system-wide. UPMC in Pittsburgh, 17 hospital system. They are 11 years into a transition. It's supposed to go live this year, and still 3 of their facilities won't be on it, right? So it's like so much money and time and effort spent on this. And it's challenging, right? Because at the end of the day, when we look at digital collectibles or self-governing, right? Like transacting by yourself and on yourself or by yourself. The one thing that are we ready, right, for this digitalization of healthcare records? And I'm not sure we are, right? Like, so they don't have any like business school classes for physicians in medical school, although they should. But they do have like a whole section on like WebMD, right? And how to work with patients who come in quasi-educated, right? Because it's going to slow down the pathway. You have to take a different pathway, all that kind of fun stuff. Are patients actually ready to self-govern that information? I don't know, right? How much should or shouldn't they? Who's going to be the person to say how much and when, right? It's a whole big transition that I think we're going to, at least in the States, have decades of discussion over before we see, in my opinion, very meaningful change. But we have to take like small bites, right? And I have a couple of examples of those, but I don't want to hog up too much more time.
Well, I have an example of where adoption might go a bit quicker.
I love it.
Yeah, and this really jogs this memory of I think there are some companies who are working now with refugees. So the situation with refugees just going across countries and trying to access healthcare in these countries, I think there is a real need for them, because at this point, what's happening is that they are the custodian of their own data. And they work in really low trust environments, and they have to kind of go country to country and trying to kind of give their medical history and all that. And if they don't give it right, then they receive the wrong treatment or get delayed treatment, and this can be quite dire for people who are already living in difficult situations. And so I think, when we think about EMR, it's really like electronic medical records, it's really very national based or very health system based, and there's no interoperability, even across hospitals in the US, much less across countries where these refugees are. So there is real need to kind of put this maybe on the blockchain, and for them to be custodians, and because they are already custodians, that adoption might be a bit quicker. And for them to then allow access into the health records to whoever they meet on the way. And also that level of privacy, I think that's really important, and that's something that they can kind of own.
So technically they are not NFTs, but they are like non-transferable.
They are not what? They're not what? Yeah. So I think that is probably, when we think about adoption, is really where the need is, and it has to come that way. And I think a lot of blockchain adoption or digital assets adoption might actually, you see that happening in the global south a lot more, and low and middle income countries, because for one, regulation is maybe not that strict as well, and that gives space to explore. And I think people are hungry for opportunities and to do things. So I think we'll be seeing a lot more of that.
Yeah, and this can be another opportunity also of the income, because when we look at third world countries, they have all the data. They have the genome data. How they're moving. Most of them already have some smartphones on, so they're collecting their health data anyway. But now the big governmental organizations all own this data. So if we use this kind of digital collectibles to give the power of the data to these persons, then they can actually monetize this data and use it for their income. So maybe it's like $5 per month, but it's still big money in some part of Africa.
Yeah, no doubt. And there's an interesting project coming out of Pittsburgh, Heny, H-E-N-Y, if you're interested in looking at it. So the whole business of biobanks is gigantic, right? Trillions of dollars. So for those of you who may or may not know what a biobank is, so it's a collection of tissue samples, right, that an institution would then use to do various studies, right? It's most commonly found within cancer, right? And one specific one is breast cancer. So you go in, you get a diagnosis of breast cancer, you send off your tissue samples to PATH. They would then go into this biobank, and then that biobank, typically housed within a university, would then be used to drive a bunch of research, right? So to try to figure out different therapies, this and that, and what have you. With all of that pathway, though, comes a lot of red tape. From institution to institution, it can be 2 to 3 years before you get granted any type of access. So if Mayo Clinic wanted to work with Johns Hopkins, 2 to 3 years. Sometimes they don't even try, because the red tape is just so ridiculous. In this case, if you were to go in and use Heny's product, they would actually give you custody of that tissue sample, right? And then that's a biobank that they house independently. So you have all these institutions doing all the same things, spending all the same resources to store all these things, and there's not a single biobank in the United States that's profitable or that's in the black, not a single one. So you're gonna see a lot of them drop off in the coming years because they're just too expensive to maintain. So this solution gives an opportunity to share those resources from a cost perspective, but also gives the ability to have these institutions collaborate, which is ultimately what you want anyways, right? You could be working on the same thing at two different institutions. It's a ton of waste of money and time. The third step, which is really interesting, so let's say that my tissue samples actually drive some sort of innovation or drug or treatment or whatever else. I would actually be compensated for that, right? And when you talk about the burden of disease, part of it is leaving a family behind, right? Loved ones behind who then don't have access to you as an individual, right? But there's a whole socioeconomic aspect and impact of that as well. To be able to gain some sort of impact through ownership, right, of your own tissue in the development of some sort of drug and be have your family or yourself be compensated for that, that's a big deal. It's one of the coolest applications that I've seen yet that I think will be, in the next year or two, you'll hear a heck of a lot more about it. So I'm really excited for those types of things. I think it has to be small, little bites that we can chew off. If we try to go to global digital passports tomorrow, good luck. We're not going to get very far. But I think just those small things and helping to educate other folks about it and the value of it is going to move this whole space forward a heck of a lot faster.
Yeah, I guess I want to maybe ask the other of my panelists. How has it been trying to get people to adopt the idea of using Web3 products or using blockchain technology with healthcare space is really a very Web 1 space or Web 0 space sometimes. How has that experience been?
I think when there is real value, but the people see, then they adopt it really fast. Yeah. Or the other thing is when they have a force. For example, we can look at the COVID certificates. I think this was a really good example how fast humankind then figure out one standard that works pretty much everywhere. The only thing why was technically it was still not very good. So they could be in blockchain and be in this digital form. But it's a very good example how it could work and really be much better.
Yeah, I think it's going to be interesting. I spent 10 years working for Da Vinci Surgery, so it's the surgical robots, and it was at a time where we were mainly focused in cardiac, and nobody wanted to use these things, right? They were better used as coat hangers in the operating rooms, because everyone's kind of afraid of it. I don't know about that thing. My hands are pretty good, so on and so forth. In time, though, what people found is you were able to do more advanced procedures with better outcomes for less money. And unfortunately, the C-suites at most facilities saw the $2 million bill, right, for that robot and said, no way. I can't make money with this thing. Oh, well, meanwhile, if you were able to attract one additional colorectal cancer patient, that equates to about $85,000 worth of additional revenue for your facility with one patient. And that's just surgical costs, not upstream, downstream costs. So each colorectal cancer patient is about $450,000 to $500,000 worth of revenue within your institution. You need 4. Right? So until you start wrapping your mind around the actual economic impact of adoption, it's really hard for a lot of these folks to no, I can't do that, right? I got top line, I got bottom line. The numbers got to mesh. Mm-hmm. Do they? They're hard dollars and soft dollars here. Let's figure it out, right? So I think in time, we're going to see more of that thinking. And you actually have some really good examples of, so how do we, there's a lot of these really storied institutions who are, teaching the cutting edge things, right? Allegedly, that don't know anything about blockchain, right? That don't know anything about self-custody, that don't know anything really about applications of AI and ML. They're just starting to scratch the surface of it. So how do you be the person, the institution that people look to for answers on, technology adoption? You have to educate yourself as well. And I think there's going to be some catching up there, but you've got some great examples of
I think
your process
sorry,
there.
institutions.
Yeah.
I think the disclaimer is that I go to Harvard, and I think just in the last year I've spent so much time trying to get people on board with this idea and hey, this is interesting. It's not just AI. We need to talk about blockchain too, and it's just been so hard people get a bit scared. They hear all these buzzwords coming. And for AI, they've got ChatGPT, they're engaging, right? They're using it. And if you're not in the NFT space, you're not in the crypto space, what's gonna happen is that you just don't have that kind of engagement. And I think as much as I try to on a very academic sense, try to get people to come on board and to kind of join me in like thinking about, you know, what we can do in this space. It's just been so difficult, and that I've kind of gotten to a level of like doing all these little workshops for my fellow classmates, just about basic onboarding to Web3, you know, like we start them on a digital wallet, I put them in OM to walk around the metaverses, just to engage. And then I drop them a digital collectible participation cert, and then they get so excited about it. Yeah, but just little things like that. I think at the end of the day, it has to start from like a very education level and to start engaging people and start them talking about it, yeah.
Yep, I think we have like 2.5 minutes left. Do anybody has any questions?
Yeah, that can two and a half minutes. I can make it quick though. So there's a lot of different reasons. If you want to stop innovation at a hospital, involve the IT department, and that'll pretty much stop it, right? Like they have a lot of jurisdiction, and a lot of the answers that are desired, some of them don't exist, right? So getting someone who's very like black and white, I need the zeros and ones to match up, to be understanding of we don't know yet, but we have to move forward. Like we have to make a decision. That is like an interpersonal one. I think the other one is because when EMRs came out initially, everyone and anyone was doing EMRs. Like 98% of those companies don't exist anymore. Might be more than that now. And that actually created a huge problem where we have all this information that we're not allowed to throw away, right? But it doesn't communicate well with the current or future structures. So when you look at the use of blockchain for those types of things, it would be really nice, like we have like the same wording for anatomy, right? Sagittal, lateral, medial, blah, blah, blah. Having those shared terms around blockchain technology as it relates to healthcare would really move things along. You get stuck in the weeds on the smallest little things. Even conversions, right? Conversions to metric to English. It's a big deal. And if you're not paying attention, mistakes are still made. We had our daughter in the ER 2 or 3 months ago now, and they still made like medication issues with like calculations. And I'm like, I don't think that's right, But if you're not paying attention, those systems aren't infallible. But there's a lot of reasons. But it just takes time to match everything up and to be perfect. Yeah.
So let's now check how many push-ups we have to do.
You got one.
I got one.
I got 2, I think.
Yes, you got 2.
Okay, let's do this.
Okay.
I don't think I got any.
You can join us.
No.
But in solidarity, I will do it.
Yay! I'm just gonna come ahead.
How many? We're just doing 2 push-ups?
Yeah, do 2 with me.
Okay.
Oh, we're going behind?
Yep. Okay.